National EMS Week is underway, underscoring how EMS and hospital personnel are improving outcomes together.
Yeah, joining us this morning, Hartford Healthcare, Shannon Spalding, EMS Care Coordinator at St. Vincent's Medical Center. Shannon, thank you for being with us. You're in a very high-tension line of work. Why did you choose to go into the emergency medical services field?
Thanks for having me. Actually, I fell into EMS incidentally. I started in emergency services in high school as part of a community service project. And I found a career that was, quite frankly, so humbling and rewarding. I've been able to progress from EMT to paramedic and now an EMS educator. I can't imagine doing anything else.
That is incredible, and obviously thank you for the work that you do. What is so unique? What does St. Vincent's have to offer for someone who is looking to perhaps enter the paramedic EMT profession?
So St. Vincent's, we run in-house EMT and paramedic education. We've also partnered with the University of Bridgeport, Sacred Heart University, and soon to come Harding High School to provide EMT certification programs.
As we know, EMS works very closely with hospital emergency departments to save lives. Can you talk about the importance of teamwork in getting the patient outcomes that you want?
Absolutely. It's really all about the mutual respect for the expertise that comes from the pre-hospital staff and the in-hospital staff that really drives those patient outcomes. Here at St. Vincent's, we even practice what's called an EMS timeout, where we take a very quick pause just to make sure that all of those team members in the hospital are truly engaged in receiving all of the pertinent information from the EMS crew, bringing those patients in so that they can get the best care possible.
Yeah, I'd imagine working closely, working together as a unit, as a team is very important. Now, here's a question perhaps that patients may have. Does someone have a choice of where they get emergency care if they call 911?
Patients absolutely have a choice. While destination hospital is primarily driven by patient condition and their particular needs, patients always have the right to voice their preferred hospital and have that discussion with EMS providers prior to transport.
Shannon, can you talk a little bit about the education you have and the steps you needed to take to get to the position where you are today?
Absolutely. So I actually started as what is now an emergency medical responder, an EMR. And it's that first step into EMS. Many people take the first step as an EMT, and we provide that education here. It's provided all over the state, and those are nationally accredited or based on a national standard. Sorry. Once you're an EMT, you can go work in the field on an ambulance. And if you make the decision to progress to paramedic, we provide that education too. That is a much longer course, but absolutely worth it in my opinion.
Wonderful. Shannon Spalding with St. Vincent's Medical Center. Thank you for your time this morning.